Hello and welcome. Today we're going to be talking about a very special parasite drug called Praziquantel. This talk is going to be for educational purposes, but it's really important for you to understand how helpful this drug is, like basically what it treats, how safe it is, the effectiveness, the dosages that your doctor would prescribe so that you can work together with your healthcare provider to treat the parasites that are causing whatever condition that you're dealing with. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. The topic today, very, very clearly, is that it's for educational purposes. I'm not telling you that you need this parasite drug. I'm not telling you you should take this parasite drug. What I am saying is that what people are starting to become aware of is that when we have chronic diseases, like I was diagnosed with multiple sclerosis, a lot of the research is starting to show that a parasitic infestation is causing the disease. So then we hear that and it sounds so promising, but it's really hard to find practitioners that have a lot of experience in helping us to treat. So we have to do a little bit of background work or do our homework and have an understanding of kind of which of the parasites we may be dealing with and what effective dosages are, what effective parasite drugs are, because our practitioners, many of them don't know this. It's not really hard, but this is the work that we do in the Live Disease Free plan. I was diagnosed with multiple sclerosis over 35 years ago, and by the grace of God, I learned very early on that I was dealing with a parasitic infestation, and so that's how I have recovered. And if this is all new to you, and like, Pam, how can you say that parasites cause MS or chronic disease? Watch my masterclass training. There are so many different studies that I've shared, a lot of research, like many studies, scientific papers linking MS with different types of small roundworms in the central nervous system, MS linked with developing tapeworms and tapeworm larval cysts, multiple sclerosis with a malaria type protist, also Lyme disease, lots and lots of studies linking MS with a spirochete, babesia, etc., fungus. So there's so much research there. And so we have the research, and then we have a lot of wellness champions that have recovered by following the Live Disease Free plan. But you're more than welcome to work with us, or you can work with your practitioner. But I would really like this to go mainstream. And so this is why I'm sharing this, is that I'm really hoping that practitioners will take this information and it'll tweak their curiosity and help them to really dive deeper into these topics. So we're talking about one parasite drug today. It's not going to treat all parasites that a person could have, but it's called Praziquantel, and it's a very special parasite drug. It's listed as one of the essential medicines from the World Health Organization. And it was discovered not that long ago, basically 1982, or I should say it was approved in 1982 in the United States. But Praziquantel is a drug that treats flatworms, so tapeworms and different types of flukes. So when you have worms, when we pass worms, we can pass roundworms that are more like a cylinder, and they can be so small that we can't see them, or they could be several feet long. And then there's also flatworms, so they look more like a tapeworm would look more like a ribbon. It would be long and flat. But the flukes are shorter and they're wider, and Praziquantel is used to treat both mainly the flatworms, the tapeworms, and the flukes, not just intestinal flukes, but liver flukes and also blood flukes. And it's so important to talk about this because we don't really appreciate how we are dealing with flukes in developed countries, because we think, like, everything you read about in the studies is like, oh no, that's more in Asia and in Africa, but in India, we don't really have intestinal flukes in the developed countries. But according to different doctors that I study under, they say, yes, we sure do. And so this really gets overlooked a lot. So praziquantel is used to treat especially something called a condition called schistosomiasis, where we have these blood flukes. And these blood flukes can really impact our liver, our intestines, our bladder. And we know that when we're sick, a lot of people have bladder issues. And apparently, schistosomiasis is a lot more common in the developed countries than we realize. It's not always just E. coli, and it's not always just Borrelia that causes Lyme disease. That there can be other microbes that can cause bladder issues, but schistosomiasis is a really, really huge issue, and we're ignoring it in the developed countries. So praziquantel will also help to treat other worms. So the really, really large Ascaris worms, it's not the main function of it, but sometimes parasite drugs, when you take them together, there can be a synergistic effect. So although the WHO says that it's not fully effective, so it's not like 100% cure rate, it has been, the WHO reports that at least 290 million people needed this treatment in 2019. 290 million people needed this treatment of praziquantel to treat schistosomiasis. That's in the world globally. It's been used for years and years, since 1982, and it's safe for children. There's been millions of doses given to children. I'll talk about that in a minute. But we're going to talk first about its mode of action. So praziquantel is absorbed. It's actually sold as, the active ingredient is praziquantel. If you guys have any questions about praziquantel, make sure to type your questions in the question box. I think the reason why it's so important is because many of us do have tapeworms, and many of us also have flukes. For myself, that was one of the parasites that I'm sure that's what I have. They're very, very characteristic. Their shape, they're wider. They're maybe, up to like a centimeter wide, and they might only be like 3 to 4 inches long. 3 inches typically, could be a little bit bigger. Those would be more intestinal flukes, and that's treated with praziquantel also. So that's why this is really important, that we don't just focus on the roundworms. So praziquantel, when we take it in a tablet form, it's absorbed and it's metabolized by the liver, so we need to know that. So it is metabolized by the liver. It will cross the blood-brain barrier, and it is excreted in the bile. So then it enters the digestive tract where the tapeworm or the fluke is exposed to the praziquantel. It's like in very simple terms, it's like a soap. And what it does is it washes away the protective coating on the outside of the worm, and it damages the surface of the worm. So it increases the cell membrane permeability of the worm. So it destroys, like it disrupts the structure on the outside, the surface of the worm. And so then it loses its ability to hold on to our intestines or wherever it's living. Sometimes they're living in our blood, sometimes in our bladder, sometimes in our intestines. So the worm starts to have some terrible spasms, and so it damages the surface, and it also causes like contractions and spasms, causes the worm to die, causes our immune system to actually see the worm and actually go after it. And so because of the way that this is happening, the worm ends up getting killed by our immune system, and it's being digested. So very often we don't see the worm in the stool if we're just only using, and this is what they're saying. We've seen different though, because we do the oxygen type therapies, the oxygen type enemas. And when we use those in conjunction with parasite drugs, we do see the worms. Maybe we can't quite analyze exactly what species they are, but we definitely can get a pretty good idea if they are roundworms or flatworms or flukes, etc. So the praziquantel increases the permeability of the cell membrane of the parasite, and it really induces contraction of the parasite muscles, causing the parasite to become paralyzed, and in a contracted state. And so the dying parasite kind of lets go because it normally will hold on to wherever it wants to stay. So it lets go. And then our immune system will deal with it. It breaks it down. Again, it can cross a blood-brain barrier, and that's a really important thing to note because we sometimes need parasite drugs, or we need our practitioners to prescribe parasite drugs that will cross a blood-brain barrier if we have parasites in our central nervous system, and we often do, and we have diseases like MS, ALS, etc. Just going to make sure that you guys can see me here. Awesome. Yes, you can. All right. And so let's talk about the safety track record of Praziquantel. It has a really high safety record. So when you hear the word Praziquantel, I don't know, I just thought it was really, really toxic. Like when I was tested, energy tested, and my practitioner wrote a prescription for it. And it is quite expensive. I know that in the underdeveloped countries that it's quite cheap, but it's really unfortunate that in the developed countries that these parasite drugs are so expensive. I think in Canada it's around like $200 per treatment cycle. But it is safe for children over the age of 4. They have not determined if it's safe for children under the age of 4. And this is like World Health Organization. They haven't determined if it's safe for people over 65. But it has been given to millions and millions of school-age children. It's tolerated really well, and it only stays in the body for a short period of time. Very mild adverse events. It's tolerated by all age groups, and it's used for especially treating the flukes. And so like in countries where there's like epidemics of flukes, they will give them to everybody in the school, whether they have it or whether they don't have it. And it's tolerated really well by everyone. So like, for example, in 2014, it was reported that during the last 3 years, more than 45 million doses of Praziquantel was distributed across Yemen to school-age children to tackle schistosomiasis, the blood fluke. And so to 45, is not 45 million children, but 45 million doses. And I don't know if it was one dose they were given, but they gave it to a lot of kids. So it is actually a very, very safe. I think it's considered to be the safest parasite drug. So schistosomiasis, which is it's a chronic group of disorders caused by a small parasitic flatworm, and it's commonly called the blood fluke. It looks like a little piece of like liver kind of thing, and it's characterized by inflammation. So that's the thing with flukes, and we don't pay attention, or we don't even think about flukes, because how would we? Like, our doctors don't talk about it. It's not something that comes up. And they cause a lot of inflammation in our body. They cause a lot, like as they become more populated in our body, they can cause a lot of like swelling, edema, pain, all kinds of symptoms, like lots of inflammation. They are like notorious for causing tons of inflammation. And again, bladder issues, liver issues, intestine issues, wherever they set up camp. So this is so significant that it's been reported, I've seen this several places, but next to malaria, it's probably humanity's most serious parasitic infection, being endemic in some 78 countries and affecting some 240 million people yearly in Africa, Asia, South America, and the Caribbean. And so the problem is they're saying, no, it's just only out there, but all these people are moving to our countries. We're traveling to their countries, and just because we filter our water and we chlorinate our water, that doesn't mean that we don't have flukes. It's just we're not looking for them. So practitioners that I study under, they say that schistosomiasis is really, really common. It's probably the biggest common of bladder issues in the developed countries also. So think about that if you're dealing with bladder issues. So I'm not saying that all bladder issues are caused by these blood flukes, but it could be a lot more than we realize. And so I'm such a believer in this because myself, I've seen the intestinal flukes, and whenever I pass them, they're the ones that cause a lot of like symptoms. You can sense them when you kill them. When you kill them, they pass these little antigens, poisons that cause your immune system to react to them. And it's not like it's dangerous or anything, but it's like you definitely can feel when you've killed a fluke. I can for sure, and my students say the same thing. Same thing with the large roundworms too, but flukes seem to be a little bit more pro-inflammatory. So again, it's really a huge deal because it's the second most important parasite in the world, like affecting more people in the world. That's crazy. So the treatment for praziquantel it can be associated with Herxheimer type reaction, just as I mentioned. Like if you're killing these flukes, they're releasing their toxins, and that can cause your immune system to react pro-inflammatory. And that's why it's really important to do the prep work that we do in the Live Disease-Free plan. So we never ever start with somebody who's really, really sick and like weak and disabled, and then they just start treating parasites like crazy. That's not a good thing to do. So we work with their practitioner, and we help our students to understand the importance of changing their diet and stop feeding these parasites so much so they're more quiet, supporting their body, and then they're feeling a lot better before they start to treat. And that's really important so they can avoid these Herxheimer type reactions caused by the release of antigens from the flukes. If you're really, really sick, like you're dealing with severe chronic disease, almost on death's door, and then you start to treat parasites aggressively and you don't manage, even taking binders and things like that, then you can run the risk of having some kind of an acute issue. It could be respiratory failure, it could be swelling in the brain, it could be, swelling in your blood vessels, because when you are infested with parasites, right, and then you start killing too many too quickly, not in a controlled manner and not where your immune system has been supported first, you can have like an out of control war where your immune system is really overwhelmed. And so that's even things like, when we have neurological diseases and we have this neurocysticercosis, we have the developing tapeworm larval cysts in our brains. We've talked about that on one of my blog posts, videos, etc. You can go and read up on it. And then sure, if you just kill off those parasites really quickly, then the doctors are worried about having a fatal Herxheimer reaction. So we don't have to be scared, but we have to be wise and we have to be smart. And that's why, again, what I'm sharing with you is solely for educational purposes. It's just to show you that this is not something that you should ever, just go, oh, okay, I read about this drug, this parasite drug, and I'm just going to go and buy some and I'm going to take some. You can really hurt yourself, or you're going to just make the parasite drug resistant. And they talk a lot about with praziquantel because the dosages, and we'll get to that a little bit more in detail in a minute, but the dosages that they're recommending is not super effective at curing from these flukes. And so they're worried about the flukes becoming resistant to praziquantel. And when that happens, then you no longer have that as a tool in your toolbox for treating parasites. So for example, if a person has, let's say, heart irregularities, maybe you have an arrhythmia, you have a racing heart or an irregular heartbeat, for example, you've got some kind of a heart condition. Very often these heart conditions are caused by a parasite in your heart area. And so it's very important that you are working with somebody, that you're being monitored if that's the case. Like some of our students have had to use the pacemakers, for example, before they started working with us. They were using pacemakers. And one of them actually, when he finished our program, his pacemaker died, like, because he had it in him for so long and it was going to get replaced, but he didn't need it anymore because like his heart was totally regular because he treated the infection. So very often it's infections that are causing the heart irregularity. Also liver enzymes being elevated. So some of us might go and get our comprehensive blood work done, just a comprehensive panel, and find that our liver enzymes are elevated. Very often it's just because we've got parasites in our liver gallbladder meridian. It could be that we've been on a medication that has impacted our liver, but more often than not, it's just we're dealing with parasites in that area. And so then we need to treat them, but we need to do it in a safe manner that doesn't hurt our liver. So we treat, and then the liver enzymes are up a little bit. We then, let it settle down. We support it, the liver, with different things. We can support it with different supplements. And then we, once the liver enzymes settle down, then we treat again in a very strategic way. And then eventually the liver enzymes don't go up anymore. But we want to manage the treatment of these parasites. I see every week like huge, huge worms, like worms that are 12 inches to 24 inches and even longer. And so when you're treating worms that are like that big, or even intestinal flukes that are 3 inches to 5 inches long, you have to manage the kill because you want to be safe. You don't want to be hurting yourself, putting yourself at risk. And they definitely do cause reactions when they are being killed. And you can minimize that through a very successful prep phase in the Live Disease-Free plan. So again, we want to protect our liver. Approximately 80% of the praziquantel and its derivatives, so as it's broken down, they're excreted through our kidneys, almost exclusively in the form of metabolites. And we talked about the neurocysticercosis, how people that have that condition, that they are using praziquantel and it seems that they tolerate it well. The research is showing that. So that is the tapeworm larval cysts. But if anyone has had seizures, and even just having that condition, if it's been confirmed, then your doctor will want to know that and monitor you. So sometimes doctors will give just a single dose of a steroid, maybe on the third day of treating, just when they feel that the die-off is going to happen, and that way it avoids a Herxheimer reaction in your central nervous system. And then the simple thing is, if doctors are treating children, they just have to make sure that the kids are not going to choke on the pills, right? Because it's always in a pill form. It's got little lines where you can cut it in half or you can cut it in a quarter, depending on what the doctor will recommend for treatment, for dosages. But for me, I can tell you my personal experience with it because I had to use it because I tested well for it. So either I had tapeworms and or flukes, and by what I've seen, definitely flukes, intestinal flukes, possibly tapeworms also. But for me, it was funny because like with treating with my students, when they're treating, I'm always saying, make sure you have food with your meal. When you're taking your parasite drugs, make sure you have food. So I just had fruit in the morning, and I was just taking 2 drugs that I was prescribed, parental palmate and praziquantel. And I took those 2 drugs. I had like a kiwi, and I took the drugs with a kiwi, and I threw up, and I felt so horrible for probably, I don't know, 15, 20 minutes. I just felt like terrible. And I was just, this was like the first time I'd ever tried it. And I was just like, what the heck? And I really like to be like a guinea pig for my students. So like I always do everything. I test everything myself too. But then what I found is that, as I was passing these intestinal flukes, the more I passed them, and the better I felt, I noticed that I could take these parasite drugs with very little food and I didn't notice any difference, which is crazy. So just one second, I'm gonna get some water. So what I'm trying to say is that when you have a parasitic infestation and you take these parasite drugs, and that's why we have to take them in a certain strategic way. Also, we don't, like, if your doctor, prescribes 5 parasite drugs, you're not going to take them all 5 at one time. I wouldn't advise that because it's a lot. And you can get, we call it angry worm syndrome, where the worms or the parasites, they react very strongly to this. So then you're better off introducing them slowly, like take 1 parasite drug once a day, maybe twice a day. You take it twice a day after a couple of days. Then the next, bring in the second one once a day, twice a day, 3 times a day over 3 days. So you bring it in slowly. You're still bringing them in and you're still using effective doses, but you're not doing it all at once really hard. And you're having food with it. Have a meal. Don't just have a little piece of fruit, especially when you have the parasites. And so then after I had treated for a couple, 3 treatment cycles, and I took the parasite drugs and I got sidetracked and I forgot to eat, and I was diagnosed, or I was prescribed 5 parasite drugs. I took them all and I forgot to have breakfast and didn't notice anything. So it's not the parasite drugs that are causing the adverse effects, it's the reaction of the parasites to the parasite drugs. But of course, if somebody had liver damage or kidney damage or something else going on, sure, there could be some other issues. But for the large part, in my experience, it's like the less parasites I have, then you don't even notice you're taking these parasite drugs. They don't affect you at all. But at the start, you have to just be aware that you're going to poke the bear. Like if you have a serious chronic disease and you've got a parasitic infestation, you are going to, they're not going to be happy about this. And so that's why we do all the prep work first. We're feeling a lot better. And we bring in the poison slowly. So we're kind of hitting them, kind of sneaking it in. And all of that makes it so that we tolerate it so much better. So then, yes, I carried on taking the parasite drugs and I took Praziquantel just fine. It did, when I had those parasites before I passed them, I did feel a little bit more nauseous. I'll go over the side effects that you could experience with Praziquantel. So you could feel a little bit more tired. You might have a slight headache, a little bit of drowsiness. You could have itchy skin or a rash, but that's probably not super common. It's very minimal adverse effects. Like I said, a little bit of tiredness, fatigue, drowsiness, and the fever. I don't think that that would be a real case, not common. Uh, a little bit of lack of energy, might feel a little bit more weak. Abdominal pain, of course, that would be a parasite reacting. Vomiting, that was me because I didn't have food. So make sure you have food with your parasite drugs for sure. Diarrhea is possible, and muscle aches and pains and nausea. So if you don't eat enough food, you might feel a little nauseous, but it's very, very minimal, especially if you do all the prep work. That's the key, is doing the prep work. Then people just take the parasite drugs and they go, oh, it's not bad at all. And I'm actually, noticing more improvements with their mobility and all those other things. So even though it's considered the safest among all the anti-helminthic drugs, so those are the worm medications, the potential for the emergence of drug resistance and its ineffectiveness against the immature and egg phases of the parasite warrant a search for new drugs that will be effective against all stages. So that's the problem. So Praziquantel is really helpful. And this is where, when you're working with somebody who's helping you to build a plan to treat parasites, you have to consider that just because you're taking a medication that treats roundworms, it doesn't mean that it's treating the eggs of the roundworm or the larva, the immature form, or the adult. It might be treating only one phase of the life cycle. It might be treating 2 phases. And so if you don't know that, then you think, oh, well, I got all the adults out, but there's a whole bunch of eggs that never got killed. And then they start hatching, and then you still have the same problem. So these are the things that we're working out in the Live Disease-Free Plan. We're very aware of all these things, and we know that this is really important. And here they're talking about drug resistance. So my concern is that there's a lot of people that are just, they're desperate. Like they know they're dealing with parasites. So they're just like trying different drugs on their own, just picking dosages. They don't even know if it's the right dosage. They don't even know if it's the right drug. And that really concerns me because number one, you can hurt yourself. Number two, if you make the parasite resistant to the drug, you can't use that in the future anymore. It's not available to help you to treat. And then eventually that fluke will become resistant to that drug everywhere. So this is where I think that it's really important to use a combination of drugs. It's also that you test well for. It's also really important to include the herbs, very important, and also to use the oxygen type therapy. So when you're using strategy and you have first done the prep phase, so you've first had a lot of symptom improvements, and then you're using herbs and parasite drugs in combination, and you're also using the oxygen type therapies, then you have a winning combination. And then you have to understand the basic life cycle of the parasites. So you know how long to treat, with your cycles. And then you also know when to treat, like how often to treat. And I think it's a really important thing to not to quit too soon, because we've talked about how some of these parasite drugs, they can lay 200,000 eggs in a day. And so that's a really big problem. That's a lot of eggs in a day. And then we have to also consider, are we deworming our pets? Are we deworming our partners and our spouses? Are they being dewormed also? Are we doing something with our produce? We should really be treating our produce a little bit to clean it a little bit better. We can use some different oxygen type, food grade hydrogen peroxide, etc., because there can be some, lung worm eggs underneath the lettuce. We can get it from our pets. We can get it from eating in a restaurant. Maybe in a restaurant, we should eat more cooked food, right? These are all just things that I think about. We definitely have our dogs outside now. We have the types of dogs that can live outside. We love animals. I'll never give that up. But, I wear gloves when I'm feeding them. I have a pair of gloves that I use. I wash my hands after. I just, because of my history of what I've been through with parasites, I'm just really more aware of it. And it's really frustrating that it's, most people just don't even know that that's what they're dealing with. It's really crazy. So again, Biltricide is the brand name. That might be more expensive. What we always like to do is look for generic and compounded parasite drugs, which are a lot cheaper than the brand names. Let's see here. I think I got most of all of this. I'll see if I'll go to your questions right away. So we'll talk about the dosage for a minute. So I don't want to go deep into dosages because I could get censored, and I'm not a doctor. I don't want to pretend to be, that's not what I'm doing this for. I'm doing this to create awareness that, oh my gosh, maybe I have intestinal flukes. Maybe I need to be energy tested for Praziquantel, and maybe that's one of the really important ones for me. I never even thought of that. I'm just, maybe you're just thinking about the common treatments for roundworms, et cetera. But the what the World Health Organization and what Bayer are recommending, the dosages that they have, and you can find them online. You can even go to pdr.net. You can find dosages there. You can talk to your doctor about dosages. You can check, I'm sure, on the Bayer's website. You can check on the WHO, the World Health Organization's website for, I'm sure if you just type in WHO and Praziquantel dosage recommendation for treatment. Um, but basically, what I've heard twice now is that the recommended dosage is way too low, and there's studies. And what I'll do is I'll put the studies in our blog post, so make sure that you're connected with us. Go to our website, livediseasefree.com, and put your name and email so that you always get notified with our newsletter. And so then on Friday, when we do our newsletter, I'll put the studies there, and you can see how, in countries where they are following the guidelines for the World Health Organization, as far as dosage, they're finding that it's not strong enough, and that it, like what the doctors that I studied under, they said it should be double what we were told that we should be using for treating these flukes. So that makes a big difference. If we're not taking a strong enough dosage, then it's not really going to be enough. So I mean, the good thing that we're doing is we're using a combination of drugs. And it's really interesting because I'm seeing, a study of levomizole. I did an article on that, and I did a video on that, and I believe that was a long time ago that there was a study, and hopefully I'm not getting it mixed up with other studies, but it was like over 4 years where they gave MS patients like one dose of levomizole once a month, I think it was, for 4 years, and they had way less attacks. And I saw that levomizole is also helpful against flukes, and which was the other. There's a few different ones that thiabendazole is also. So, like with our students, we see what they energy test well for, and some have tested well for thiabendazole and levomizole, and of course, praziquantel and niclosamide also. So then you're just like, you're seeing all these connections, and it makes me wonder if one of the really big culprits in multiple sclerosis is flukes. And I really, I'm putting it out there now, and we'll see as we keep researching. This is where we just kind of connect the dots, and eventually, so our students are passing a lot of other roundworms too. And I'm not saying that it's always flukes, but I'm just wondering how often that is, because I have family members that pass a lot of big roundworms and they don't pass flukes, and they don't have MS, or they didn't have a history of MS. And I'm wondering, could that be one of the parasites that's different in us than in other people? I don't know, but it's very interesting. So the effectiveness of it, and again, it's very important in the research that we've done over several years now of really using these parasite drugs, with practitioners, et cetera. We found that they're not a magic cure. And so please don't think that they are. If you think I just need to get my hands on this and I'm going to be cured, you're not. And you may feel really awful. So it is a combination again of getting ready to treat, getting stronger, feeling a lot better. Like we have one student that just in literally like 2 to 3 weeks, she's gone from 31 years of having MS and using a scooter to a chair lift, to a stair lift. She's been able to stand now, and she's able to walk 3 steps, like up 3 steps, 3 stairs. She's walking, and she's just following the diet and getting her bowels moving. She's doing the prep phase. And so when you do those things and you're feeling a lot better, then the parasite drugs will be tolerated better, and they're going to be more effective along with the oxygen therapies and the herbs all together. But just one on its own, the parasite drugs are not a magic cure. Really important to let you know that. All right. So I'm going to see if there's a couple of questions. Hi, Tiffin. What is the name again? Just signed in. The name of this drug is called Praziquantel. Praziquantel. And that is Praziquantel. Prazi, just like it sounds, and then Quantel. Hello. If tapeworm is in muscle, in back, the intestines, do they die there? So the tapeworm adults will live in the intestines, but their immature form, the larva, will move into muscles and form cysts in muscles. They will move, and that is the cysts there, and they will also move into the central nervous system and form cysts there also. That can be just like a sack of developing tapeworms. And in the brain, it's called neurocysticercosis. Hello, Gary. One dose, multiple doses. Well, according to like the World Health Organization, I believe they're just doing one dose. According to other researchers, they're talking about 2 doses, but in the doctors that we work with, we're doing treatment cycles. So we're treating for like 10 to 14 days at a time. and then taking a break. So that's with the doctors that we have studied under and the doctors that are prescribing. It's 10 to 14 days of treatment. And that would be in combination with other drugs. So the students wouldn't just take one. They never test well for just Praziquantel on its own. And that's probably a lot more helpful. How much steroid, the dose? It's dexamethasone is one of the steroids that's used. You'll have to check with your practitioner. That's something you would never, ever want to mess around with. Steroids are really, really powerful. But it's called dexamethasone. You can ask your doctor about that one. We work with students that have neurological diseases, and we have not had any issues with like terrible Herxheimer reactions, like fatal seizures or anything like that. And I think, again, it's really important that we are doing the prep work. But if any of my students do have a history of epilepsy, I really do recommend them to, talk to a doctor about getting a steroid while they're treating. I think it's better to be safe than sorry, for sure. Thank you so much for your kind words. The life coach medical model. You're very welcome, Tiffin. Do you treat people in Canada? So we help people to access practitioners and access treatments all over the world. And we have worked in well over 20 countries, including Canada. I'm located in Canada also. So it's a little harder in some countries than other countries. But if you are just finding this for the first time and you're like, gee, I didn't know parasites could be causing my issues, then watch a lot of my videos on YouTube and on Facebook. Also on our website, that's probably the best. Our website, livediseasefree.com, we have a blog there. And if you go to the blog, you can pick and choose what kind of topics you want to look at. You can see my notes. You can go click on links for references. And then from there, you can watch my masterclass training, which really explains the research behind this. It explains the steps we take to recover. I share a lot of case studies of people that have recovered from MS and other chronic diseases. And you have all the steps. That's the big thing. And then if you're at the place where you really understand this, and I should backtrack too, we have the Live Disease-Free Diet Guidelines on our website, livediseasefree.com, under research, in the main menu under research. You can click on that. You can print off the cheat sheet, start applying the Live Disease-Free Diet right away, start noticing symptom improvements. And then once you are ready, if you can't find a doctor, if you need help, you can watch my masterclass training, fill out the form, and then you can book a time to chat with me, and we can support you in the Live Disease-Free plan. So we support people in this whole process. We have a lot of experience. As I share everything because I want this to go mainstream. I share as much as I can so that I'm trying not to get censored. But I also want to be responsible. I'm not telling anybody to take anything. I'm just sharing what's on the internet. Like, you can go out to the World Health Organization. You can go to pdr.net. You can just look up the dosage for Praziquantel for treating, anything, like for roundworms, tapeworms, etc. And those are drug websites, pharmaceutical websites. So you'll get that information. But that doesn't necessarily mean that's what you need. And so if you want to get well, you have to follow a proven plan. You've got to have support. You have to be safe. And you've got to work with professionally trained healthcare professionals. You're very welcome. You're very welcome. So awesome. So I'm going to let you guys go. So just start thinking about, that just kind of open up your mind that you may not just be dealing with roundworms, intestinal flukes, and we're going to continue to study and continue to research. And it'll be very interesting to see if, what percentage of people with chronic disease do have intestinal flukes. Like, the thing with flukes is that they seem to cause a lot more inflammation than the roundworms do. The roundworms do cause inflammation, but the flukes are just super nasty. And so this is just one example of a treatment that's incredibly helpful to be part of our recovery plan. But again, it's not the whole answer, and you have to use it safely and effectively under the guidance of a healthcare professional. So with that, I'm going to let you guys go. I hope you have a wonderful week. Take care, and we'll talk to you next week. Bye-bye for now.